Hi, good evening. Good evening. Hi, good evening, everyone. Dr. K here from True Vibe Wellness. I'm going to give some time for people to join in on us. Join us. What am I talking about? Join in on this live. Um, Tonight we're going to talk about high blood pressure and erectile dysfunction. So get your men together. Please share this with your uncles, your dad, your grandpa, your brother, your stepdad, your brother-in-law, stepfather, stepson. Please go ahead and share the link. Tonight is going to be about the men. It's going to be about the men tonight. It's about to be about the men. It's going to be about the men tonight. I'm tongue twisting here. Well, good night, everyone. It's been a while. How are you doing? How are you doing today? How's everyone doing wherever you're watching across the world? Hopefully everyone is doing well. Good evening. I'm gonna give it a couple seconds and hi. Hi Tahima. Good evening. How you doing, girl? Um I'm gonna give it a few seconds here to give some more time so that more people can join in. Good evening, everyone. Happy Thursday. We're almost at the end of the week. Almost at the end of the week. Hi, everyone. Good evening. Good evening. Welcome as you join in. Welcome, 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 welcome. It's pre-Valentine's weekend. I don't know if any of you celebrated, but happy pre-Valentine weekend. All right. Hi, Mom. Hi, Mother. Good evening. How are you doing? All right. So I'm going to give it about a couple seconds here because I don't want to keep us too long. So we can get started here. All right. So because I want to honor everyone's time who actually, joined on time. So for those who don't know me, but go ahead and share the link. Share the link to your men, your brothers, your uncle, okay, your stepfather, your cousins. Go ahead and share the link. Tonight is going to be about the men. We're going to focus on our men tonight, men's health. All right. We don't pay enough attention to our men. So we need to give them their respect where it's due. And we need to take care of our men and their health. So tonight will be about men's health. Okay. So good evening, everyone. So my name is Dr. K from True Vine Wellness. I am located in New York City. We had some snow last night until this morning, so I think we're a little bit tired of it now. We love it; it's the blessings of the Lord, but the cleaning up. It looks beautiful and pretty, but the cleaning up. So tonight I'm going to talk about high blood pressure and erectile dysfunction. What really inspired me to talk about this topic tonight is because this week I've been seeing a good amount of men with ED, erectile dysfunction, also known as ED. And with high blood pressure in general, about 103 million adults have high blood pressure, and only 24% of that number have it under control. And some of this percentage are men. And, you know, I do see men as well, who they come in asking, I want something for my manhood. I want something for my manhood. I want something, you know, because, you know, they are, and these can be young men, like 40s, early 50s, you know, young men. You know, sometimes they're healthy. And I will talk about there's some, you know, there's some conditions that actually can create erectile dysfunction, but I'm going to focus more so on high blood pressure tonight. But I will mention some things that can affect men. So, you know, with men, this can be that can cause a lot of insecurity in them. Um, you know, so the more we know, the more we can educate ourselves, the more knowledge we have, we can empower our men, right? So we're not using it against them. We're not saying that it's an issue for them, you know, that's their fault. We can now educate them, you know, give them the right things that they need. Okay, so I may share some of like some pictures with you guys so you guys can have a visual. But I'm going to talk about again, and also some antihypertensive medication that can also be a side effect causing ED. Okay, so I'm going to be going in between ED and erectile dysfunction. All right, so all right, I'm going to get started. All right, so erectile dysfunction affects about 30 million men in the United States, and 50% of men that are affected are between the ages of 40 to 70. So 30% suffers with ED, or those with hypertension, also known as high blood pressure. So erectile dysfunction, what is this defined as? It's defined as persistent difficulty achieving and maintaining an erection sufficient to have satisfying or fulfilling sex. So some of the underlying causes of erectile dysfunction is smoking, abuse of alcohol, recreational drugs, prescribed medications, health issues that involves blood flow and nerve supply, has diabetes type 2, high blood pressure, which is what I'm going to focus on tonight, high blood cholesterol, which I'm going to touch upon as well, obesity, being overweight, metabolic syndrome, Parkinson's disease, multiple sclerosis, hormonal disorders, such as thyroid conditions, testosterone deficiency. So men who they may have ED, but they may not have high blood pressure. They may have their testosterone levels may be low, right? Treatments for prostate disease or a history of a prostatectomy. So men who have had their prostate removed, right, because they may had prostate cancer or they may have had an inflamed prostate, you know, that caused them to remove their prostate. And this actually can also cause or create erectile dysfunction. So this is why sometimes for me, and personally for me in my practice, when you know when men come to me with this issue, you know, it depends on where they are, right? So I always encourage them, you know, if your doctor's encouraging you to get rid of your prostate, get a second opinion, right? Where is it? Because right now, you know, if you have prostate cancer and, you know, it's like you're in stage 4, or your PSA, which is what they call prostate specific antigen, pretty much which is measures, you know, the health of the prostate, but that is not a diagnostic test because a man can have prostate cancer and they have normal PSA levels, right? So but however, you know, some doctors will recommend, oh, you know, your prostate is inflamed, you have high PSA, get rid of your prostate. It's going to get worse, especially if they have a genetic predisposition where their father had it or their grandfather had it or their uncle had prostate cancer, or something what they call benign prostate hyperplasia, which is basically the inflammation of the prostate. You know, so all these different things can play a role in why a man may have erectile dysfunction. And also, if they're severely stressed out, they're experiencing anxiety, depression, and that's another thing that I've been seeing a lot too since been experiencing this pandemic. Stress levels has increased, anxiety levels has increased. So if this increases, erectile dysfunction also will increase. Okay, so drugs that controls high blood pressure, such as ACE inhibitors or angiotensin receptor blockers or beta blockers, can create erectile dysfunction. Heart medications, some diuretics. Diuretics is pretty much what they call like the water pills. Drugs that work on the central nervous system, anti-anxiety drugs, antidepressants, and some painkillers can actually create and cause erectile dysfunction. So I'm going to focus more today on heart disease and erectile dysfunction. So, as I said before, conditions that create or lead to erectile dysfunction or diabetes, hypertension, cardiovascular disease like coronary artery disease, smoking, high levels of stress, or you may even have a nerve damage. So, for instance, if you were in a car accident or you had accident on your job, and the area that you damaged, ever since then, you've been having issues with erections. That also is a cause, right? Alcohol, overuse of alcohol, low testosterone levels can lead to that. So the answer to that is lifestyle changes, quit smoking, maintaining a healthy body weight, increasing physical activity. Okay, so I'll go more into that. So basically, I have a whole graph here, but we'll skip that for today. So atherosclerosis. So one of the things that actually can lead to erectile dysfunction is what they call atherosclerosis. That's pretty much like built up fats and cholesterol, and which leads to plaque in the arteries. So what happens is that the arteries gets a little bit instead of it being like a normal, circumference, right? It gets smaller and smaller and smaller, and then blood flow cannot go through, right? So it restricts blood flow. So atherosclerosis can be caused by lifestyle habits. Okay. So common cause of blood flow issues is atherosclerosis and heart issues. And it can also affect other areas of the body as well. So the leading cause of heart disease is atherosclerosis, strokes, and peripheral vascular disease. So the atherosclerosis actually can create a narrowing or clogging of arteries in the penis, preventing necessary blood flow to the penis to produce an erection. So if you know a man, or you men who are listening to me now, if you know you have heart disease, you have high cholesterol, things like that, this could be the reason why. And if you don't have erection issues, if you continue to stay on the path of having high cholesterol, heart disease, this is what can happen later on down the line. Okay. So high blood pressure. What is high blood pressure? So high blood pressure, also known as hypertension, is force of blood against your artery walls, and it becomes too high. The pressure of blood is too high. So normal is usually 130/90, right? That's the new normal, 130/80. Okay, so symptoms of high blood pressure is pounding and feeling in the chest, in your head, dizziness, lightheadedness. Okay, many tend to have high blood pressure without knowing they do, right? High blood pressure is also known as a silent killer. So someone can actually have a high blood pressure and don't feel a thing. Okay, so men with high blood pressure are twice likely to have erectile dysfunction more than men who have a normal blood pressure. Okay, so ejaculation and sexual desire can be negatively affected by high blood pressure. So women, wives, if your husband is not desiring, right, intimacy, it may not be you. It maybe they have a health issue going on and they don't know how to voice that, right? So, that can create some, insecurity for them, fear, right? Nothing's gonna work out. So they rather just stay away from altogether. Okay. So it's knowledge is power, so medications that actually can affect this. So many individuals, men and women who are on, who have high blood pressure, they tend to be on a diuretic or water pill. They tend to be on a beta blocker, right? They tend to be on an ACE inhibitor or something like that to help control the blood pressure, right? That's used to treat high blood pressure. So, but these drugs, these pharmaceuticals can actually decrease blood flow to the penis. So diuretics actually depletes your body of zinc. And zinc is a mineral that is necessary to help support the prostate gland, okay, which also participate in an erection. So zinc is very essential in making testosterone, right? So diuretics, I'm not telling you to stop your medication. That's not what I'm saying tonight. But if you know you're on a diuretic, on a water pill, make sure you're taking zinc as well. And also zinc is great for the immune system. So I definitely encourage that, okay? Diuretics in a whole deplete your body of your minerals and your nutrients, okay? So if you are experiencing erectile dysfunction, please speak to your primary care physician. Let your doctor know. They could probably switch out your medication just so they can keep your blood pressure under control or reduce the amount that you're taking. Maybe the dosage, they can reduce it, but don't hide from it. Don't be ashamed of it, right? Because erectile dysfunction can be a side effect of the blood pressure, or or the medication that you're taking. So just make sure you check in with your doctor, right? Because we also don't want you to have a heart attack either. So please check in with your doctor. So I have, okay, let me see here. I have an image here that I want you guys to see. Trying to see if I can. I'm trying to see if I can. I'm trying to see if I can do a share screen here. I don't know if I can. Okay, I can. So, hold on. Sorry, guys. All right, so you guys should be able to see this, okay? So basically what this image depicts, it actually shows you what the lumen, or also known as your vessel, blood vessel, should look like. So when you look to your far left of the image, okay, a normal blood vessel, that's what it should look like, where your blood flow flows freely, okay? As you keep going to your right, people with high blood pressure, diabetes, high cholesterol, they smoke a lot, they're overweight, they don't move around much, a lot of physical inactivity, that vessel becomes smaller, okay? What they call endothelial dysfunction. So the vessels are unable to dilate and the blood is slowed down, right? So you can see the circle is a little smaller, right? As you keep going, someone with atherosclerosis, right, plaque, blood flow is further slowed down, right? So now you see the lumen, right, is getting closer and closer. The vessels is getting closer and closer. Blood flow cannot flow as much. And then as you keep going now, right, there's a full closure where there's no blood at all. And that's where a heart attack comes in, right? And that's not where we want at all. Blood flow stops, okay? But if we go in the reverse, if you go and look at the bottom of the image, it says, okay, certain things to stop, right, to reverse this. Lower your cholesterol levels, lifestyle changes, exercise, quit smoking, and some medication that you need to take, which some of you are already doing. Okay, so back to me here. So basically, it takes lifestyle changes to change your erectile dysfunction. Okay, so the first things first, take care of you. Okay, don't think about, like, I don't want your first thing to be about, oh, let me stop taking my medication so I can have a better sexual intimacy with my wife, right? That shouldn't be your first thing. The first thing should be take care of you, work on the underlying issues that has gotten you to that stage. Changing your diet, lifestyle changes, change what you're eating, right? Start eating, across the rainbow, vegetables, fruits, a lot of fiber. Fiber is important in our diet, especially if you have high cholesterol, right? All of us should be having fiber in our diet because that helps with good bowel movements. But especially if you have high cholesterol, you want to make sure that you're eating a lot of fiber rich foods, things like oatmeal, vegetables, seeds, nuts, fruits with their skin, organic fruits with their skin. Okay, make sure you have that, because what fiber does, fiber basically connects itself to cholesterol in your liver. Your liver is your organ that basically cholesterol is processed through. So what it does, it attaches itself, and then now it converts into your digestive system, now moving out into your bowel movements, right? So fiber is really important for us all, not just those who have atherosclerosis or high blood cholesterol or high blood pressure, okay? So limit or cut out processed foods as much as you can, okay? Processed foods tend to be dead foods anyway, like a lot of breads and a lot of fast foods, fried foods, cut out that or limit it as much as you can. Because I know there's certain situations you have men who are truckers on the road, and the only thing that they may pass is a Wendy's, or they may pass some fast food joint, right, that they can find. So you do your best with that, and you pick the healthiest thing you can find in the menu, a salad and some, something, right, a fish sandwich, something, right? But you do your best to pick what's more fiber filled, nutritional, that had the most nutrition in it. Okay, exercise regularly. It's important that we exercise on a day-to-day basis. It don't have to be anything vigorous, it can be gentle. Okay, 30 minutes of exercise, right? Decrease your stress levels as much as you can. So decreasing your stress levels, exercise helps with that. You can also take some nutritional supports to support your stress levels that I won't go into tonight because I'm not talking about stress, but there's nutrients that you can take to actually, and herbs you can take to support your stress levels, okay? If you are overweight, you want to lose weight. If you're obese, if you're overweight, men, lose weight, okay? If you're overweight, that can contribute to erectile dysfunction. So you want to make sure you have a healthy weight. And the way you can lose weight without even trying too hard is the first thing I spoke about, changing what you're eating, okay? And exercise. Those two things can help you lose weight without you even doing too much work, right? Stop smoking. If you are a habitual smoker, you want to stop smoking because you are killing yourselves. You're not only just creating worsening erectile dysfunction, but you're also killing yourself, period. You're killing your cells, 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 and your selves, selves, okay? You are killing both. And also you're depleting yourself of so many nutrients like B vitamins and all these different things. So you don't want to stop, you don't want to, keep smoking. If you're smoking because there's some other issues going on there, then you need to find out why you're smoking. What is it that you're trying to find? What is it that you're trying to seek after, right? Is it social smoking, and et cetera, et cetera. All right. So reducing the amount of salt in your diet. So we have our Caribbean men, right? And our Caribbean women that love cooking with our seasoning salt, right? Our noodle soup packets and all these things. But guess what? It's a no-no. It may make our soup taste a little good, our food taste a little better, but guess what? It has a lot of sodium, high in sodium. It has MSG in it, monosodium glutamate in it, MSG. So if you notice, sometimes you eat certain foods, you may get a little headache. It's too much salt. Sodium is too high. So our foods can taste just as good with fresh herbs, with no processed salt, right? You can use seasoning salt, but a little bit, because some people are still sensitive to the sodium. So you can get seasoning salt, sea salt, that can basically, it has the minerals in there that your body needs, or you can use something called, you can use kelp, right? Or you can use seaweed. Seaweed is from the seed, has this natural, salty taste from the ocean. You can use that to season your soups and your foods as well, okay? Limit your alcohol consumption, right? Our body is the temple of God, right? What we put in it, what we do with it matters, okay? So in a whole, limit your alcohol consumption, okay? Limit it or omit it altogether, okay? Because this is actually contributing to erectile dysfunction. Beers, Hennessy, all these vodkas and things like that. You're not only damaging your liver, but you're also contributing to erectile dysfunction. If you don't experience it now, eventually it will come to that. Okay, then you're gonna find yourself trying to go, and do other things to kind of help that, and it won't be a healthy approach at all. Okay, so the next thing is nutritional and herbal supports. Okay, one of the things that helps with blood flow to the penis also is vitamin C. Vitamin C is known as a vitamin that's great for what? Immune system, right? It's good for skin, right? But it also increases blood flow. So take it supplementally, eat more foods that are rich in it, such as oranges and lemons and cantaloupe and strawberries and tomatoes, broccoli, Brussels sprouts, vitamin C. So you eat a lot more of that, okay? Another nutrient, also known as a mineral, that's important for erectile dysfunction that helps support that is zinc, right? Zinc is great for immune function. Zinc is known to help make our DNA and protein production and cell division. It plays a role in cell division, but also it helps support the prostate as well, and it also helps support testosterone levels, right? And testosterone is the sex hormone that contributes to an erection. So sources of zinc are like lamb, right? Nuts, legumes like chickpeas, lentils, those type, and whole grains are sources of zinc. But also it's good to supplement with it as well. Vitamin D. Studies have shown that men with erectile dysfunction, they are also actually vitamin deficient. Okay, so it's really important that we, that you men, you take your vitamin D3. Okay, supplement with vitamin D3 is importante. Okay, it's muy importante. It's very important. Okay, so it's not just good for the immune system, but it's good for hormone production. Every organ in your body, and I can't stress this enough, has a receptor site for vitamin D. So it's good for a cell, strengthening our cells, good for hormone production, everything. So men, take your vitamin D, please. All right. Some other supports to help support with erectile dysfunction is ginseng, Chinese ginseng, also known as Panax, or AKA red ginseng. What this does, it releases nitric oxide, assisting with erectile dysfunction. It can help with erectile duration, penile rigidity, and it improves libido as well. Okay. But this is to be used for short term, and this shouldn't be a long term thing. And also, you want to be careful what medication you're on. So please talk to your doctor before using this. And that's a disclaimer I'm going to say with everything. Just make sure you talk to your primary care physician, before, or talk to your naturopathic doctor who can discuss this with you, like which medication you're on, and they can say, okay, will be better. Okay, because panic ginseng is actually contraindicated with if you drink a lot of alcohol, you do a lot of caffeine. If you're taking any blood thinners, any blood thinners like warfarin or antiplatelet drugs, anything like that, or NSAIDs like ibuprofen, panic ginseng actually works against this. So please, if you're on any of these drugs, just make sure you talk to your doctor before taking them. Okay, so another nutritional support for erectile dysfunction is nitric oxide. What is that? Okay, endogenous nitric oxide is needed for normal erectile dysfunction. I didn't say nitrous oxide, guys. I didn't say the laughing gas, okay? Right? Because nitrous oxide is actually used, right, in clinics and hospitals and things like that to keep you calm, and it can put you in a euphoric state, and you just start laughing for no reason. That's not what I'm talking about. I'm talking about nitric oxide. Your body actually makes this, okay? So nitric oxide is synthesized mainly in our blood vessels through the amino acid L-arginine, right? So L-arginine is needed to make nitric oxide in our vessels, in our blood vessels, right? There's other cells, right? There's other cells in like our white blood cells that actually produces this, but mainly in our blood vessels. Hence, this is what helps our blood vessel stays open so blood can flow freely. Okay, so nitric oxide, what it does, it relaxes the smooth muscles, causing them to open up and dilate, allowing increase of blood flow, right, and decrease in blood pressure, right? So what does that mean? You can also start taking supplemental L-arginine. Okay, so that's what can help support. You're not going to find nitric oxide supplementally. You need to take L-arginine. All right. There's actually a study shows that taking L-arginine along with pycnogenol, which is basically made from the pine bark of the European pine tree. It's a bark made from the European pine tree. It's actually an antioxidant, and it actually supports circulation issues. So pairing these two together has shown improved results of erectile dysfunction, right? So nitric oxide is important in our blood vessels. So things like beets, right? Drinking beet juice, and eating beets and things like that actually has, right, there's nitrates in beets, and your body converts into nitric oxide, so it's also good for circulation. Okay, other herbs that can be supportive of erectile dysfunction are yohimbe. Some of you might hear of this already. Ginkgo, right? Ginkgo biloba is not just good for the brain. The reason why ginkgo works for the brain, because it opens up the blood vessels in our brain and helps us to be more alert, and helps with memory, right? And maca root. Maca root is another one that's good for hormones balance, and it can contribute to helping with sexual desire and libido and things like that. So okay, so pretty much this is what I wanted to keep it short. So pretty much this is what I have to say regarding high blood pressure and erectile dysfunction. Hopefully this was helpful to someone. Please go ahead. Hi, Lilia. Hi, I just saw you. Sorry. So if you know of any men out there right now that you may not know, because men, they're not this is not something they just go talking about to their wives or talking about to their moms, or this is not, they don't do that, right? So you can just share this with any man just say, hey, take a look at this video, you know um and they will learn some things that they can take to help support the erectile dysfunction, because some men are ashamed of it. Some men don't want to, they don't want to they don't want to talk about erectile dysfunction, right? They don't realize that this is something that can affect them. So they don't realize that, okay, it could be the medication. And please, men, do not stop taking your medication because you want to have an erectile an erection. Don't do that, because you're putting yourself in some sort of issue to create another issue. So it's best you go to your doctor, you let them know, okay, doctor, since I've been taking this medication, I've noticed that my erections are weaker. You let your doctor know, and the doctor can either put you on a lesser dose, or they can change the medication altogether. Okay, once they find out what if you're allergic to certain drugs and things like that. So don't go taking yourself off the medication. Go to your doctor and let them know. Okay, let them know this is what you're experiencing. Okay, and just also work on your body as a whole, your health as a whole. Eat properly, eat whole foods. Give up the red meats too, right? Once in a while, maybe, like, because I mentioned lamb has zinc, but there's other sources that you can reach out with. So men, I did this for you tonight, so hopefully this was helpful. Like I said, men, especially between the ages of 40 to 70, experience this. So, and actually the younger men that I'll tend to see, like in their 30s, 20s, that have this issue is because of hormonal, testosterone levels are low, or they're smokers, or they're drinkers, right? Or it could be a genetic issue. So there's multiple contributing factors to erectile dysfunction, but the main issue for men in their 40s and 40s, 70s is high blood pressure. And also, a lot of men in their 40s, which are young men, are having high blood pressure and diabetes. And why? Because we're not taking care of our men, ladies. We're not taking care of our men. Okay, so we need to take care of our men, right? They take care of us, but we also got to take care of them. So men, whoever is watching this, please apply this. I hope this has been a blessing to you. Share it to another man, share it to your brother, share it with your friend, your uncles. You're welcome, Dahima. CMOS. CMOS can be helpful. Yes, CMOS is actually great for erectile dysfunction. I'm not saying it's a treatment, but CMOS is so filled with a lot of minerals. And actually, growing up in the Caribbean, CMOS is also used to support erections, right? Paired up with other herbs, like cheney root and strong back and these other herbs. But CMOS can support the male in terms of erections. Okay, so CMOS can be something that you put on your daily, your smoothies. You blend it up, you soak it, you blend it up. So CMOS can be helpful. Yes. So any questions before I shut off? I could go to 7:30. Any questions regarding what I spoke about, or high blood pressure, high cholesterol, and diabetes too? Diabetes and high blood pressure and high cholesterol usually come as a triad. Not everyone has all three, but sometimes they do, right? And if they don't, it end up leading to that. Okay, so high blood pressure, high diabetes. If you have diabetes and you're not managing it well, know that it's leading to, it's going to lead to other things, because with diabetes, you have the plaque that will start to build, the blood sugar build up in your system, in your blood cells, and all that, and then the plaque, narrows your arteries, and right. So that's what I am saying about erectile dysfunction. So do anyone have any questions before I log off? It was nice and short and sweet. Any questions or any comments? Was this good, guys? I hope this was helpful, because I've never really done anything for the men, and shame on me. But I'm glad I was inspired to do this, and I pray that it blesses our men out there. So anyone have any questions before I log off, or any comments? So what age a man should start checking their PSA? So men should start checking their PSA levels at least once they hit like 50, 60 years old. However, if you have a history of prostate cancer or benign prostate hyperplasia, if you have a genetic history where your dad, your uncle had prostate issues, then definitely check it earlier, like 40. Have it checked it earlier. But typically, on average, between 50, 60, a man should start checking his prostate, actually his PSA levels, because again, your PSA levels can be normal, but they still have an issue, right? So get your PSA levels checked. Also do a DRE, right? When you go to your doctor, men, you do a DRE, which is a digital rectal exam. It may not be the most pleasant thing in the world, but also keep in mind that when you do a DRE, this can falsely elevate PSA levels. So if you're gonna do the same in the same setting, don't. You do one at one visit, then you go back and do the PSA, or you do the PSA first, get that checked first, and then when you get the results of that, if that comes a little elevated, then the next visit you do your digital rectal exam. Okay. You're welcome, Mom. Any other questions? Any other questions about prostate? You're welcome, Dahima. Anytime. Anytime. All right, so I see not many questions about this because it's not something that's highly talked about. So, um, however, if you guys have any questions on the side, you could definitely reach me. TrueVitalWellness.com is my website. If you want to email me, ask me a question, email me at info@TrueVitalWellness.com, or you can give me a call at 347-433-5076. Again, that number is 347-433-5076, or you can email me at info@truevitewellness.com, or you can just go on my website, truevitewellness.com, and go to the contact page, and you can send your message through that as well. Okay. If you like a consultation, you can go by that means as well. Send me an email, let me know you want a consultation, and then we take it from there. Right now, I am doing mostly virtual consultations, not in office, due to pandemic. So, I'm doing virtual for now. All right. So if anyone across the world, I can speak to anyone across the world, or we can do, like a Zoom if that's what they prefer. All right, guys. So, all right. So that's it. No questions. So I'm going to say good night to everyone. Thank you for joining. Please share this video to your loved ones. Share this video to your uncles, your brothers, your stepfather, um, you know, any men that just send it to them, whether you know that they have ED or not, right? Send it to them so they can start to take care of their bodies. Okay. Share it. Okay. Share it with them. All right. So be blessed, everyone. It was a blessing to serve you tonight. And, I will let you know when I'll be back on again. I'm actually going to be having some guest speakers the next couple weeks. So look out for that. All right. So I'm lining them up. So, I will keep you guys posted. All right. So happy pre-Valentine weekend. So those who celebrate, enjoy. It's not just about your spouse, okay, or your significant other. Love on yourself as well. Make sure you love you. Okay. True love comes from the love of God. Okay. And that's where true love starts. Okay. The love of God is true love. And that's where we start our love. Okay. And once you know the love of God, then you know how to love yourself, you know how to love others, and also know to love you. All right. Be blessed, everyone. Take care. Have a good one. Ciao.